Honestly, the masks themselves basically will, they will not, if you have it, they're going to help prevent you from spreading it. Either one, the surgical grade hospital ones or cloth ones, they probably only reduce less than 20% of the chance if you were directly exposed to someone with COVID who coughed, very near you in your face, of actually preventing it. So they're about the same. They're not N95s. They can't basically prevent you from getting the majority of pathogens out there. They'll certainly reduce the risk substantially because these are spread by respiratory droplets. So by having a mask on, be it cloth or surgical, they'll reduce it. The efficacy is comparable. It's comparable. So it's not really that much of a difference because, they're not preventing you from definitely getting the virus if you're exposed to a high concentration, but they'll significantly reduce the air droplets because if you cough or you sneeze or when you talk, nothing's coming out of your mouth. So you're reducing your chance substantially of any kind of respiratory exposure by virtue of the mask, be it cloth or be it a mask that you could get in the hospital, one of those, paper ones. I think you can wash them in the washing machine, just as you would any other piece of any piece of clothing. I mean, let's not overestimate the value. These certainly they're going to help, but they're not as if you're in a high exposure with COVID patients. You won't be wearing this. You need much greater protection than just a mask. But this will absolutely reduce the transmission of any kind of respiratory by virtue of wearing anything over your mouth. Now, it's best to have the mask. I've gone to the store a few times and I've seen people pull their shirt up over their nose, and that's really not optimal. You really want to have your mouth and your nose covered. Well, again, you're preventing exposure. So if someone has a mask on, the odds of them spreading something via respiratory, those can help. Again, only if you're working with COVID patients. If you're with COVID patients, you have a full N95, one of those face masks going down to prevent if they coughed on you, potentially it getting in your eye where you potentially could be exposed. And that's where those are. I mean, it's precautionary. Listen, the bottom line is, Austin, we haven't done randomized controlled trials of people who are wearing masks, not wearing. We think this will help. It's intuitive that it should. It probably will. And as we go back into some element of functionality, the masks seemed a good in between, with social distancing and us getting out there. They appear to, they should have some benefit. My thoughts are they're a benefit when you go to a supermarket, it's crowded, you can't socially distance, they're a benefit. If you're able to socially distance, less so, you're outside, you're jogging, absolutely less so. But when you can't socially distance, which definitely is the case in the public settings, it's a good idea for now. It absolutely makes sense in the event anyone sneezes or hacks up. And the problem with this whole thing with COVID is there's just so many people who have no symptoms and they could potentially spread it. Presumably there's been enough education now that anyone with any symptoms knows, I'm going to stay home, I'm going to quarantine. But there's people out there who are just carriers of it and they potentially can spread it. Now that interval between that, when they're actually contagious, we haven't defined, but we're starting to get enough data now that the incubation period before you actually have symptoms where you could spread it is somewhere around 3 or 4 days. So most people, if they're going to get symptoms, there's a time between 3 or 4 days, but then there's this whole other element of patients that never get any symptoms, yet they could potentially spread it. It does appear to be respiratory, and every study has shown the majority of spread is occurring in smaller settings, conference rooms that are crowded, and families, and it's not occurring outside. That's an important point for reassurance for your viewers. Being outside with groups of people, probably safer. Of course, we'll see what happens with some of these beaches open, but presumably that much in that setting. I suspect so. I would anticipate that would likely go through the, at least for the next several months, I would anticipate, until we have more clarity on the actual prevalence of this in the community with antibodies, how many people are immune. And those tests are coming available every day, and hopefully we'll have them here soon where you get a blood test. Well, geez, I've had it. Presumably I'm affected. Of course, I've protected. Of course, we've heard, well, the antibodies, we don't know if it means anything, but if it's like any other infectious disease, when you have antibodies, presumably you're protected. So I think more and more testing being available, the rapid test being available, hopefully here soon, you'll know if you have it, then you'll know if you've had it. And with that, I think we can absolutely control this and have more comfort when we go out. Right now, people are horrified. They go out, they're afraid. If I touch this, I touch that, am I going to get it? And chances are, if you're protecting yourself, you're not having symptoms, you're probably going to be okay. But I would anticipate the masks and social distancing, I would say certainly for the next several months. Well, I don't think there's enough tests to just do curious right now. There was some random sampling that was done last week by Governor Cuomo. I think they were the closest places that were doing it were Ithaca and Binghamton, where they were randomly. Certainly someone who thinks they may have had it, I think it's definitely worth getting. You need an order from your doctor to get it done. And then when it's available in mass, I think we have to do certain cohorts of the population, just random sampling. See, geez, have they had it? Is actually immune. They estimated 4% last week, but they hadn't really done enough upstate. It was a little bit higher. It was like 12, 13% downstate. But so, I hope that number's higher, because that would mean not a lot of people have had it up here. But then the other very interesting thing, Austin, in areas like this, where we don't have population density, are we really at risk for it as much as places in the city where the population density is just intense? Everyone's on top of each other. And that, again, more studies will come out about that. But the question is, are these areas that are more rural, spread out, really at risk of spreading it as much? My hunch is we're not. Well, I think unlike many, many diseases which have been around for years, we have more information about COVID than anything I can remember in my entire medical history lifetime. It's quite remarkable, and the amount of information that's coming in on a daily basis. This will be one of the most studied diseases in mankind. And I think that with that, I would think the hope of treatment and a vaccine hopefully would be on the horizon soon, with the amount of effort and brilliant minds that are being put to solve this crisis. So I'm optimistic. There's a light at the end of the tunnel. We're making progress. We're getting there, slowly but surely.